Hi, Chris Lindley with Vail Health, and I'm here today with Dr. Casey Wolfington from Eagle Valley Behavioral Health. And we wanted to give a quick update to folks around Omicron, but specifically what it's doing with our mental health, the anxiety, the worry that folks have watching the media. So tell us a little bit about what you're seeing in the community and how we might be able to best handle this news.
Yeah, absolutely. Well, there's three factors that actually contribute the most to anxiety, which are changes, restrictions, and unpredictability or lack of predictability. And the fact is, with COVID-19 and the variants, we have all three.
Yep.
And so the fact is that we have to recognize that we're really set up for anxiety. So we have to learn how to manage it, how to cope with it. So for those of you who are trying to figure out how to cope with this anxiety, go see a behavioral health professional, work with someone. But it doesn't always have to be therapy that helps us engage with our behavioral health. A great solution is getting outside, being around friends, doing all the things that we can do, and also reminding ourselves that although we've been in a place with mass restrictions, there's a lot of things that we can really safely do now, especially because we have vaccines, we have boosters, and we have all of these different pieces that protect us.
I think that's wonderful. The other thing I want to, briefly ask you about is, as we look back of this last, what is now almost 2 years, we've actually seen more behavioral health concerns come from the community in this valley than physical health because we've been so healthy, right? The community's done such a good job protecting themselves against COVID, and we were the first ones to start vaccination up here, and we have such a high vaccine rate. How can we think about our overall mental health going forward differently, knowing that that's going to be a huge component forever going forward with COVID-19?
Absolutely. I think that, as you have said, Chris, in a number of our videos, that COVID-19 or a version of that is going to be here to stay. Yep. So waiting to address your behavioral health or waiting to be around friends until COVID is gone is not going to happen. So we need to start addressing that now. We need to do things that make us feel happy, do things that reduce our anxiety, even if there are pieces of risk in it, because, it's too risky not to take care of our behavioral health.
I love it. And the last thing I want to have you share with us, in this valley, we actually have behavioral health care available for anybody. We actually have a scholarship fund. Tell us a little bit about Olivia's fund and who can access it and how do you access it if you need the help.
Absolutely. So Olivia's Fund is our behavioral health scholarship program. It is available to anyone who identifies a behavioral health financial need, and it provides access to a minimum of 6 sessions of behavioral health care. The other piece is we have a new program in our community that provides stabilization 7 days a week. And so every single day we have the ability to connect with a clinician.
Perfect. So for the first time ever, finances are not a barrier for seeking the care you need. We want everybody to know if you need help, ask for help. You shouldn't be ashamed or nervous about asking for help because what I'm hearing is we're all dealing with this. Yep. This is a hard thing for us to manage psychologically, but it is our reality and we need to do it together and support each other as we go forward.
Absolutely.